What's up, guys? Going to be waiting for Dr. Russ to jump on here in just a minute whenever he gets up and going. As people get on, feel free to ask questions as we dive into it, but I'm stoked for this. We'll see how long these things take to press this through. Hey, Joel in the house. Mom in the house. Waiting on Dr. Russ, the star of the show. See what this wave button does. What's happening, Joel? Yeah, I waved. Let's see. Hey, what's up, Edwin? Waiting on Dr. Russ to get in. Our star of the show tonight. An East Coaster. I don't know if many California people are home from work yet. Dominican Republic. Oh, that's awesome. There's Russ. Dr. Russ is in the house. Let's see here, Russ. Should be a button to join. I'm not seeing anything on my end here. There we go.
What's going on? What's going on, dude?
Dude, thanks for jumping on. Yeah, we got someone from Dominican Republic tuning in.
Whoa, Dominican Republic.
Yeah, that's the furthest I know. It's a long way from Cali.
What's going on, man? How you doing?
I'm doing good, dude. How you doing?
I'm good. I'm good. Kids are down for now. Fingers crossed. My wife just got home, so she'll take care of it moving forward. But excited, man. Excited to have me on. I appreciate you having me come on here and just kickstarting this Tuesday
Absolutely,
IG Live series, man. That's great.
Yeah, I appreciate you jumping on. I've known Russ for maybe connected a year and a half, 2 years ago.
Yeah,
maybe.
I want to say I feel like when I opened up my business, I think we kind of crossed paths, and I know you had started your business very, very close to when I started mine. So I feel like we've been kind of on parallel paths, maybe more on the West Coast and East Coast, but it's been a great relationship so far.
Yeah, so I'm super excited for this. I was on Russ's mentorship group maybe a month or so back. He's got some cool things going on with that. Hopefully, we might be able to talk a little bit on that. But
Sure.
Just excited to have you on, trying to get some cool individuals. There's some awesome guys and girls I know that are out there doing some really cool things. So just trying to hear a little more about what you got going on and kind of just keep spreading that news. So just let me know a little bit about what you're up to. Let's start professionally. I know you got your business out there, so just tell me a little bit about that.
Yeah. So I've been, I've been a PT now for 10 years this year, and I've been a strength coach now for about 13. And I would probably label myself first as a strength coach and who just happens to do PT. I think coaching, regardless if you're in PT or if you're in strength conditioning, coaching is coaching, right? And I think that's where the epicenter should be with regards to what we want to do in terms of performance, in terms of strength conditioning. I own Mana Performance Therapy. It's a performance-based PT practice in Rochester, New York. It's in a 5,000 square foot strength conditioning facility known as Next Level Strength Conditioning. Our facility is attached to two ice hockey rinks, so we see a lot of hockey players, And then I also have a satellite office at Cobblestone Creek Country Club, which is about 15 minutes down the road. And that is tailored to a lot of the country club members, golf specific. And again, my background with rotational sport athletes, with being TPI certified, it's allowed me to kind of niche down a little bit more and do more specific stuff for golfers, for hockey players, and then obviously we do some work for active individuals, CrossFit population, barbell sports, things like that too. So, we definitely have our hand in a couple of different things, but I want to say mostly it's more kind of tailored to the athlete and the active individual more than anything else.
Yeah, that's awesome, and I 100% agree that strength coach mindset in the PT world is they should look pretty similar. And so, hockey players, golfers, why don't you talk a little on just the rotational athlete in general and how maybe a little bit about their needs and how that is similar to active individuals and how it differs?
Sure. So I definitely think, when we opened up our practice about 1.5 years ago, we just felt like the athlete in general, I think the way athletes are managed from the traditional healthcare model, I think they're an underserved population just in terms of, okay, listen, you've got a soft tissue injury, the normal recommendation is rest until the pain goes away and then go back to your sport, right? And you're seeing all these high rates of soft tissue injuries, ACL ruptures, Achilles, so on and so forth. And we just felt like when we opened up our business, we wanted to kind of tailor to that athlete. In particular, you look at hockey, you look at golf, you look at baseball, you look at tennis, all these things are rotational sports in particular, obviously with our hockey and golf, right? So I think the ability to create strong athletes and based on the foundational movements, right, is where we try and kind of put a lot of our footprint on, right? I think if athletes can be stronger, be more resilient, be more adapted to stress, then I think, especially from a rotational standpoint, a lot of those nagging injuries that come on, low back issues, we see a lot, hip issues, we see a lot. These things maybe hopefully start to kind of come down or reduce the likelihood of those things kind of happening if we build a strong foundation of strength, stability, and obviously capacity that these tissues can handle over the long haul. Because again, let's be honest, kids are playing sports at a higher rate. They're specializing at an earlier age. And unfortunately, you're seeing the breakdown of some of these tissues and some of these younger kids happen at a younger age. And it's unfortunate because I think there's obviously a very, very strong body of evidence that shows sports specialization should not be occurring until obviously later on, high school age, things like that. But unfortunately, we're seeing a significant rise in youth athletic injuries, and that's where we want to try and kind of at least put our mark on that and figure out how best can we navigate these waters to get these athletes to understand that strength training should be the center of what they should be doing. And again, it's structured based on the age, right? The younger they are, we're not doing structured strength training like we are with older kids. But again, you still want to make sure that they're understanding that the stronger you are, the likelihood you are to reduce the likelihood of that injury kind of happening from it.
100%, yeah. I'm interested. How much would you say is managing their movement, building that base of strength, versus how much is managing how much their tissues are being loaded through? Because that's got to be a huge thing you see with these youth athletes. And how do you go about managing some of that?
I think a lot of it comes down to one, expectation, right? And having a realistic expectation as to, depending on the length of time an injury's been going on, how long things have been, obviously giving them trouble, but maybe not noticing it until maybe recently. I think having an honest conversation with parents, if they're involved as well, and just trying to figure out, hey, listen, this is what, little Johnny's got going on here. Yes, it's been going on for the last couple of weeks, but obviously if it's been on and off for the last couple of months, years, whatever it may be, then it's going to take a little bit longer to kind of reload that tissue or recondition that tissue so that it can handle more stress. I think the biggest thing that we do, and again, it depends and varies on the population, right? If we're talking high school, college, pro, then I think what we utilize a lot in our clinic is more an RPE-based type of parameters or protocol, I guess the best way to put it, right? RPE is rate of perceived exertion, right? We try to figure out what is that sweet spot to figure out, again, so they can, one, get an idea as to how stressful it feels to them, but also they can kind of obviously verbalize that to us so we can get an idea as to what's the load that they can handle. before obviously we get to that maybe kind of that gray area where it's too much stress, which then also could potentially flare up or provoke or trigger an issue there. So we use a lot of RPE based type things. And then from there, it's just a matter of figuring out how can we navigate schedules, how can we navigate practice times, how can we navigate all these different things and outside variables, nutrition, hydration, sleep. I mean, the youth athlete, I mean, there's a number of things that kind of go on with kids that you can't control. And sometimes you need to understand that as well. And I think the more you can understand that there's things that sometimes just won't match up, then I think that allows you to get a better picture as to how best to manage the global idea of how to manage an athlete more than anything else.
Yeah, I think that's awesome. I mean, all the things you mentioned, and that's something that we just can't always get if we're spending 15 minutes with the person.
Right.
I think about all the things you mentioned could be a separate 15-minute conversation on its own. So having the the luxury to be able to get a full hour with them to be able to educate on those things is huge.
It's so vital. And I think, again, our model is more kind of the private pay cash-based model, right? So we see all of our clientele anywhere between 60 to 70 minutes. And in that time, a lot of the first 15, 20 minutes will be just kind of going over, hey, how are things going? How are you feeling? How are things been going since last session? How are the exercise or how's the training thing that we kind of programmed for you? How is that going? So all of it is just figuring out, you have an idea, a framework in your head as to what you want to do from a program standpoint. Most times when we evaluate a person, we'll kind of give a rough, 3-4 week block of some of the things we want to do. And then based on how they feel, based on their symptoms, based on, if anything's aggravated, we'll either scale down or we'll ramp up. It just kind of depends on how the person responds each and every week. So I definitely think you need to be flexible and, being very, very structured and very, very, fixed on a certain thing that this needs to be done at this point in time. I definitely think that can go south pretty quickly when you're dealing with athletes, especially if you're trying to build trust, more than anything else. I think if you, set such a fixed structure where they can't work around that and be, manageable and things like that, then I think it can go against to your disadvantage because the athlete then also isn't buying into what you're saying. So, I think a lot of it comes down to figuring out expectation. Again, expectation is always the number one thing that we talk about when athletes first come in, and obviously when parents come in as well. And then we try and figure out from there, how can we navigate the waters of one, still training and loading the tissues to an extent that we feel comfortable with. And then obviously trying to work on recovery, right? How's your sleep? How's your nutrition? How's your hydration? Are you getting enough stuff that'll help aid the recovery process? Because again, as much as we think that we're really good at what we do, we're only spending 1 hour, right? 1 hour of the whole week. Most times when we see people, it's on a once a week basis, right? So it's 1 hour out of the 7 days of the week that, we're seeing them. So yes, we try and make a huge impact, but we have to understand that there's so many things outside of the clinic that they need to do and need to put in place in order for them to recover, right? And I think athletes that are driven and motivated, they'll do that, but sometimes you need a little bit more of a, I think, parents need to be involved and, maybe friends need to be involved and just, it needs to be centered around the athlete so the athlete can, be successful long term.
Yeah, that's so cool, and it's cool you have that team there too within the facility.
Yes.
It's not,
oh my goodness,
it's not just you trying to take on that entire role.
Right.
But when
that's it.
When it comes to loading the stuff up, though, I love watching your treatment stuff. I mean, you're not afraid the things that your athletes are doing. I mean, they're carrying their trap bar deadlifting, they're squatting, and just tell me a little bit about the importance of that compared to loading a tendon with a TheraBand or a 2-pound dumbbell.
Yeah, I mean, I think I think it's all relative, and I think context matters, right? If someone's dealing with, let's say, a very, very acute issue, and then they can only handle so much, maybe a TheraBand is a good place to start, right?
Absolutely.
But again, your scaling and your loading has to be pretty progressive, right? Tendons respond to load, and if you're not loading them adequately, you think about, let's say, a TheraBand. Let's say you're doing like a calf, an Achilles issue, right? And you're doing TheraBand, plantar flexion, whatever it may be. Well, you think about walking is significantly a higher load than doing, let's say, something like a TheraBand. So I definitely think, not being afraid to be kind of in your own skin and say, listen, this is what we need to do in order to get you better, right? All the hands-on stuff, if we do it, can only go so far. And again, what you're doing outside the clinic in terms of your home program and your loading and all that stuff matters significantly in order for you to progress a lot faster. So again, I think a lot of it comes down to figuring out, hey, if they can handle the load, right? And again, I think, pain, right? We always talk about this pain concept, right? And, should you have pain with exercise or should you not? And I think that's, again, the context really matters. You can have a little discomfort, right? But if it comes back down the baseline, then, long term, you're not really doing anything that's causing quote unquote damage to that tissue, right? You're actually just making it more resilient and it's just being stressed, right? And again, stress is not a bad thing as long as you can adapt to it properly.
Sure. Yeah, I just had a question come on here that was interesting, Russ. You have any experience with genetic testing as it relates to training and recovery? I haven't seen anything on that. I don't know if you guys.
Yeah, I know. I know there's more and more people doing genetic testing as to, if someone recovers with this method better or whatever it may be. Honestly, we don't do a ton of it. I think a lot of it is just we get an idea as to where they're at. We look at what we control in terms of some of the different variables like we discussed. And then, we really don't play too much around with genetics. We just kind of let that be. If people want to kind of pursue that more, by all means, go ahead. I'm sure it's a costly price when you do that. But at the same point in time, we really don't kind of really evaluate that too much. We just kind of let that be.
Sure. And I think it's important to know practically too, depending on what the population is, there's probably some that when you're getting to the higher levels, if you're trying to push peak performance is different than a lot of the people that you and I may be seeing are. Absolutely. There's a lot of practical ways. We don't need to jump into genetic testing if you're sleeping 5 hours a night and eating garbage. Then
exactly.
Genetic testing isn't gonna tell us too much. So
listen, that genetic testing is not going to change the fact that you're crushing 3 Big Macs at night before you go to bed. You know what I mean?
Absolutely, yeah. So, that's great. I wanted to hear a little bit about kind of your personal training background because I think if you're anything like me, that's been a major influence in how I've come to learn. My own, like working through my own injuries and everything. So kind of how your training background started, an athletic background maybe, and then how it's evolved over the years.
Sure. Yeah. So in high school, as a 3-sport athlete, I played football, basketball, baseball. Again, I think a lot of it came down to, I like to exercise, but I did it in with regards to the framework of, improving my ability to play the sport. Right. I didn't really kind of look at training as an opportunity to make my body work at it now. See, I graduated high school 18 years ago, and I look at it now, I'm like, hey, if I maybe pay a little more attention, then maybe, I'm not dealing with some of these nagging issues that maybe kind of creep up here and there. But with that being said, when I graduated high school, I spent my first year at SUNY Cortland, which is a very well-known school for athletic training and phys ed, right? So I did athletic training my first year, and that's what maybe a lot of people don't know about me is that my first year of undergrad, I actually started in athletic training. So I was in the training room. It was just maybe a little different. And looking back at it, should I have gotten my PT ATC dual credentialing? Maybe, but I think my SCS kind of supplements that nicely there. So my philosophy of training was more I think a lot of times when people do strength conditioning, you look at the bodybuilding model, right? It's volume, it's more volume. Right. It's pyramiding. It's, let's do 12, 10, 8, 6, and then drop set everything all the way down. Right. And I think
work your way back up.
And then work your way back up. Right. So I think at some point in time, people always kind of dabble in that. I think we always kind of fall victim to, hey, listen, look, what's the next muscle and fitness coming out? What's the next, big program that comes out of that magazine? And I look back at that and I just kind of roll my eyes and be like, what are you thinking? So, I definitely think that's probably where I started. I think my training over the years has obviously changed. One, I've got 3 kids, right? So I can't train as long as I used to, right? A 45-minute workout for me now is man, that's money for me right now, right? 30 to 45 minutes is my kind of happy zone there. So I think, being flexible, knowing when to modify when needed, I think is important. And I think the big thing for me is from a training standpoint is just consistency, right? Longevity more than anything else. I think as we continue to get older and, people always kind of talk about, well, never get old or whatever it may be. And, I look at that and say, okay, well, aging is inevitable, right? So what can you do to, one, slow that process down, make your body healthier in the long run? And I think from a training standpoint, I've definitely tried to kind of accommodate, maybe not getting that hour and a half workout that I used to get in, but maybe doing it more consistently, 30, 45 minutes, 5 out of 7 days a week, and try and go that route and still be okay with that. And I think at the same day, I always used to think that like I needed to sweat. I needed to be in the gym for 2 hours in order to get a quote unquote good workout or a good training session, right? And I think I think it's subject to a lot of scrutiny, and I think it's rightfully so. So I definitely think it's one of those things where if you can kind of change your philosophy in terms of how you train and how you go about doing it, nowadays I do more full body stuff, maybe some splits here and there depending on my, the programming, where it used to be, oh, let's do, Monday is always National Chest Day, right? Let's do chest on Monday, and then maybe kind of do legs on the side here and there, right? Where now, most of my programming has been around more kind of lower body emphasis than anything else, because that's where we want to make sure that our driving force in terms of, because again, I still want to play sports, I still want to be able to kind of run around my kids and not have to worry about anything kind of nag and kind of creep up on me. So that's kind of where my philosophy has kind of changed, more from that bodybuilding mindset to more, hey, let's you talk about functional training. I mean, functional training is being able to do things from a day-to-day standpoint, but also from a performance standpoint. If you want to play golf, if I want to play baseball in the summer league, if I want to play pickup basketball, whatever it may be, I need my body to be able to handle that stress and be okay with it and not be on the couch for a week after the activity because they couldn't handle it. So I definitely think that's where my training is kind of, I think, segued to. But again, you're always looking for ways to try and improve each and every little bit every day, right? And I think the more consistent you are, the better off you'll be able to kind of attain the goals that you're looking for.
Yeah, I think that consistency is huge, because there's people that I'm sure you see that busted in the gym, 2 workouts a day, and they can push this high intensity for some days before they break, but for some weeks or months, some even can push that for years before. But eventually, if you look at the total training volume they're getting in, if they're out for 6 months, then all of a sudden, over time, they're missing out on a pretty good duration of time.
Like when you see, maybe they're just general population fitness enthusiasts, what it may be, like they just want to go balls to the wall all the time, and hey, listen, every now and then that's probably not a bad thing, but if you continue to do that on a consistent basis each and every day, your body's going to kind of sit the bark back at you and say, okay, well, listen, you're go, but what are you doing from a recovery standpoint to allow your body to continue to handle that stress? And if you're not putting the necessary steps in place in order to kind of handle that stuff, then at some point in time, your body's going to say, okay, I'm not sure I can handle this too much more. And all of a sudden you start to see these nagging injuries start to kind of creep up. And that's when you get these repetitive stress injuries that kind of happen to a lot of people that we see in the general public, in barbell sports, in athletics in general. I mean, it's pretty prevalent. It's just a matter of people think that they need to deal with it, right? Like, oh, I've got an elbow issue. I've been dealing for 6 months. That's just kind of how it is. Well, is it, right? Do we really need to just deal with it and then live with it for the rest of our lives? No. I think if you find the right provider that is a good match for you, then it can go a long way in helping you feel back as close to 100% as you can be.
Yeah, I'm sure you see a lot of that in the youth athletes too. You see some of that mentality of you're not supposed to be hurt necessarily, but it's if you tell the coach you're hurt, there's risk of losing playing time. There's a lot on the line.
There's a lot of different driving forces nowadays, right? I mean, I think now with youth athletics, if you're not with a certain travel team, if you're not with a certain team, whatever it may be, it's like, okay, well, if you don't join this team, the likelihood of you maybe progressing higher up into these higher levels, things like that, like, it's unwarranted, unfortunately, but that's the pressure that these kids have nowadays, right? If a kid is hurt, like legitimately hurt, and maybe they're playing through some discomfort, stuff like that, some of these kids try and be as reserved as they can so that they don't lose some of the playing time that they currently have, right? So, those are all the things that, become more challenging as a coach, or becomes more challenging as a PT who is trying to figure out a return to play or return to performance protocol in your head, but also navigating the understanding that the patient, like the athlete, wants to get back to playing as soon as possible, right? So if you cannot provide that for them, they'll either go down the road to get clearance from someone else, right? Or they're just not going to buy in and they're just going to go back and play, which then 3 months later, they might be back for the same exact thing because they didn't fully recover, right? So these are all the challenges that I think that we face as a strength and conditioning coach, as a physical therapist, and just someone in the healthcare field. I think that is a really, really big challenge with regards to youth athletics, or as you get into the higher levels, high school, collegiate, even pro. I mean, it gets more intensified as you go up.
Absolutely. Yeah, and I'm kind of curious to hear with what you're doing. I know a lot of PTs I talk to, a lot of students, a lot of people would kill to be able to work with some of these athletes and kind of follow that model that you're doing. And I kind of just want to hear from you a few of the people that have influenced you and that you've kind of how you've gotten down this path in terms of who's led you there professionally and from a training standpoint, some of the people that you follow and respect.
Yeah, so I mean, I remember, when you talk about professionally, I mean, there's a number of people that can kind of influence kind of how things went. I mean, I remember when I was in PT school, I would read every Eric Cressy blog, I would read every, Dan John, Mike Reinold, all these guys that were kind of in the performance realm more than anything else. And, I think it was about maybe 3 or 4 years ago, I thought about the cash model. I thought about kind of going out on my own, but not really thinking of it too much. But Jared Carter was a huge, huge influence in my ability to wrap my head around the idea of if I wanted to go out on my own, I knew I needed to be in a cash model or in a private pay model more than anything else, right? So Jared Carter was a massive influence in just his podcast. I listened to literally every single podcast that he put out. And then all of a sudden you got guys like Paul Goff, you got guys like Danny Mateo, who I know you know well. These guys are putting out such amazing content that is so easily accessible and you can take massive action on it right away, right? So for the PTs that are, listening to this or maybe are thinking about going this route, there is so many different avenues to seek knowledge. The PT Entrepreneur Group on Facebook there, I know you and I are members of it there. I mean, there are a lot of PTs that now are understanding that sometimes you need to go outside the realms of what is traditional in order to provide the care that you feel that you went to PT school for, right? That's just kind of what it comes down to, right? Just settling for a job to kind of pay off student loans, things like that. Sometimes you need to do that, don't get me wrong. But if you have a passion for something, you should not let that fall by the wayside. That should be something that should be a priority for you, whether you're meeting that right away or whether that's 3 years, 5 years down the road. You still need to try and pursue that to make sure that you're not just burning out. We see that a lot, Dave. I'm sure you see it too. We see students that come out, into the profession a couple of years out. They're seeing massive volumes in terms of, clinics, things like that. And all of a sudden, 2-3 years later, they've got all this massive amount of student loan debt, and they're also no longer in the profession because they just felt like they didn't get the opportunity that they were looking for. So I definitely think creating opportunity comes down to one, just being a hard worker, understanding, listen, if you do the work, if you read more of training, rehab, communication, all these different things can go a long way in influencing how you want to kind of package it so that when you present it to a client, when you present it to an athlete, the likelihood of them understanding what your passion is and what your vision, that should come out immediately. Right. And if it's not, then maybe all of a sudden like, yeah, I'm not really sure if I'm the right fit for them. So, getting back to your original question, I think professionally, another big influencer was Urson Religioso, modern manual therapy. For those who don't know Urson, congrats to him who just had a 6th kid, which is insane. But he was a massive. So he was a professor at my school at University of Buffalo when I was in PT school. And, seeing his evolution and seeing him kind of adapt to the changes with some of the different, modern pain care, different things that kind of went on and shifting from more heavy manual therapy based to more kind of education, exercise loading, progressions and things like that. That played a huge influence. And then he was obviously a massive influence in giving me the kind of kick in the pants to just try and just set up shop and just, do what you can to get open and open up your own practice. Because I definitely think, he was a massive change and an influence for me to be able to kind of change my mindset on what needed to happen in order for us to open up our business. So professionally, I definitely think those guys, and that's just scraping the iceberg in terms of who is influenced professionally there. I definitely think from a rehab or a PT standpoint, I did my manual therapy background through Maitland Australian physiotherapy seminars, right? And again, his model of assessment, assess, reassess, and then the subjective examination and the clinical reasoning aspect. Yes, it was maybe kind of around manual therapy, but the clinical reasoning portion of his, through his certification and stuff like that, it literally opened my eyes into figuring out how to reason and justify why we're doing things based on the best available evidence, but also based on clinical experience, right? And if we can kind of combine the two, based with the client or athlete expectation, that is a really good recipe for success when it comes to managing clients or managing athletes. So it was a massive influence in terms of our ability to assess things, but also just give us our reasoning for why you're doing a certain thing and justifying behind that.
Yeah, Russ, I think it's awesome that for the people listening, that if it sounds like you've done a lot and you have this, this awesome toolbox of skills, and that's not even scratching what you're describing now. I know there's so much more that goes into it in terms of self-learning and everything, which is super cool though for the people watching that don't know where to get started. It's just dive into whatever it is that you're passionate about and get involved in that, and knowing that it doesn't have to happen today. I think that the patience is another thing, and you kind of touched on that of you can be moving forward while still working at your current job, even if it's not your dream job, end job. And I think you're an awesome example of that.
I mean, listen, I can literally just piecemealing things together. I remember when we started our business a year and a half ago, I was doing home care on the side while trying to figure out this whole, running a cash-based practice. I do fantasy football injury analysis on the side as well, right? So for a lot of people who don't know me and don't follow me on social media, I do a lot of different things there, right? I do fantasy football injury content for Sports Illustrated. I do all these different things to make ends meet, right? Because again, ultimately my vision as to what I think good quality performance-based PT care is what I think what we're doing right now. And obviously we have a lot of room to grow. We have a lot of room to improve.
Definitely.
I'm not by any means saying I'm perfect. And, I definitely think that there's always things to improve upon. And if you're not constantly trying to strive for perfection, even though we might not ever get there, then I definitely think you're leaving your chips on the table there to, maybe kind of influence different people in either in our profession or obviously in the public there. So, I definitely think putting things together to make things work is what you need to do. And again, obviously, my wife has been a huge, huge supporter of what we're doing. And there was a higher calling. The way things just kind of fell into place for us in terms of my wife applying for a job, getting healthcare, which was a massive, massive roadblock for us. Once she got that job and it offered healthcare, and then we pulled the trigger and it was 100% in full speed ahead. So, there are things that sometimes just work out the way, you never had planned, and that's just how it goes. So I think ultimately being open to looking at your long-term vision, but still working towards doing what you need to do to pay bills and to pay off student loan debt and whatever it may be for the ultimate goal to try and work on something that you're passionate about or what your vision is, then you can do it. It's just a matter of, figuring out how best to go about doing it.
Yeah, no, I love what you were saying there too. And our vision and coming out of school when I was practicing for a few years and within a different practice, I always had this, is this they talk about having this crystal clear vision that you can see and smell and taste. And I had that, and it was always super clear until I started on the journey. And then all of a sudden things
like, wait a second.
Life happens. Yeah. You bounce around, things happen, but things end up when you're willing to adapt a little bit and roll with that, things end up, better than you can imagine them a lot of times.
They end up okay. No question.
Stick with it. Yeah.
No question. If you stick with it and you're persistent and you just continue to kind of chip away and figure it out on the fly, which is, I think, what both of us are doing, then I think it can go a long way in helping you realize that what you're doing is more fulfilling than just, doing something just because you want to get paid. Or, again, we didn't get into the PT profession to make a ton of money, right? We got into this profession to help people. And if we can do that and still be able to financially be okay, then I think that's a win-win for sure.
100%. And we haven't even touched on surrounding yourself with people. I mean, we've regularly been in contact since through social media, getting connected, and the group you have too. That's
right.
I mean, the
amount of people,
the power of that.
Yeah. So we run a small performance-based mentorship group is through our private Facebook group, and each month we have a talk very, very similar to like this. And the amount of people that have been willing to just offer their time and offer their insight and their knowledge on what their journey was to get where they currently are, and then stay in there and try and chime in every now and then based on the conversation that we're having. It's just humbling. I mean, it really is. I mean, I think people, sometimes people get afraid of social media that if they reach out to someone, they're not going to respond, or if they don't respond, it's because, they're too busy for them or they're not. And honestly, if you reach out to someone, there's a good chance they're gonna reach back out to you, especially in this field. This field is as big as it is. It feels very small, right? Yeah. To be able to connect with you on the West Coast, to be able to connect with people like Ziad and Caleb and Johnny T. Like, I mean, I would have never thought, like, here I am 10 years into practice, that I'd be networking with people all over the country. And then having people ask me where, if I know of any people in these areas to be able to refer to, right? I mean, these are things, this is the power of networking. This is the power of social media. And this is the day and age that we live in. And it's a matter of adapting to that and making sure that you can be open to these ideas and making sure that you're not just so closed-minded. And although social media can be kind of a weird place sometimes, there is a lot of good there that can be had. And if you try and use it as an opportunity to grow, then that's what you want.
Absolutely. Yeah, nailed it. And I think social media can be like your life in general. If you surround yourself with the good, you'll find the good, and people aren't gonna, don't be hesitant to reach out. I know you've been a huge mentor to a lot of people, and it's just cool to see that's going on all over too, more than we see.
Right. More than we see it, no question about it. You look at a lot of the people that are offering their help and offering their ability to either help on either just mentor them professionally to navigate the waters of applying to PT school. Once you get in PT school, figuring out how to study and just figuring out the best way to be a professional. Right. I think a lot of times when you're in school, you want to be in school and you want to kind of have a good time. And by all means, listen, when I was in school, I had the best of time, right? But at the same point in time, you still need to have a professional aspect to it. And I think that is the opportunity to, when you're in school, like, you got to be thinking about that vision now. Like, here I am. So I just started teaching at Nazareth College, which is a local college here that has the only PT program here in Rochester. And to be able to talk to some of these students and kind of just influence them and just have them start thinking about their idea of what they want to do when they get out of school, like, that for me is super, super fulfilling. Right, and to be able to kind of at least help them streamline the process, so then when they get through their rotations and when they graduate, they hopefully have a better vision as to what they want to do, so that they're not just kicking the tires on, oh, well, should I just take a job here and just kind of see how things go? Or this is what I want to do. This is the plan I have in place. Like, let's try and figure out what we got to do to make it work, right? So being able to influence that and be able to pay it forward to a lot of the current students here, I mean, it's awesome. It really is.
Yeah, it's cool you're doing that. Yeah, I'm excited to see how all those things come together for you.
Yeah.
Well, I don't want to. I know we could talk forever. There's a couple questions that I wrote down from.
Right.
Because we could roll for another hour.
On this. Yes, we could for sure.
One of them was on hip impingement. So I know this is something you see a lot of. If you want to talk, just maybe a bird's eye view of assessing and treating that.
Sure, yeah. So hip impingement, obviously, we see a lot with a lot of our hockey folks with barbell. And, I think, if you look at the body evidence that's available to us currently, hip impingement, I think, is relatively normal, right? I think it's something that everyone deals with, probably everyone has at some point in time. And it's just a matter if it becomes symptomatic or not, right? And if it becomes symptomatic, I think the rabbit hole that people go down, it's really ugly, and it can get ugly fast, right? If hip becomes symptomatic, and all of a sudden, when you talk about the different types of impingement, whatever it may be, you're thinking, soft tissue, whether that's muscular, whether that's cartilage, whatever it may be. And if there's some sort of approximation where you're getting some pinching in the front side of the hip or in the groin, and all of a sudden you get x-rays, and all of a sudden you see all these different things on x-rays, and then they want an MRI to see if there's a labral tear, and then it becomes very, very slippery. And if you look at some of the evidence that's available to us, people that are getting hip scopes or hip arthroscopies or surgeries, they're not really getting back to a level of performance that they're really kind of expecting, right? Mm-hmm. So I think the way to approach hip impingement or any type of pathology is, if it's symptomatic, how can we calm it down, right? And get it back to a level of, where, their day-to-day isn't really kind of bugging them, and then get them back to a level of performance, right? And that bridge can be different for a lot of people. There's no cookie cutter way to get about doing it. It's a matter of figuring out, one, what their anatomy looks like, right? If they've got some anatomical variations, then you need to kind of consider those big time. If they've got maybe a lack of strength somewhere, then you need to kind of, shore that up a little bit, and work on, strength, mobility, capacity, all kind of in one, to make sure that the overall performance of the hip is functioning at a high level. And then obviously make sure that it's not coming from the back, right? We want to make sure you can kind of rule out low back first before you kind of just delve into the hip, and make sure that we're not missing anything from the back that could be potentially playing into the hip there. So I think hip impingement, it's relatively common. I think it's just a matter of if someone is symptomatic, what can we do to get it to calm down and then work on building that tissue back up so that we're not just going down a rabbit hole of, well, you might need surgery or you might need an injection or something like that, where it becomes really, really, the proposition and the risk there is it's more than you want at that point in time if you're dealing with something that's relatively can be managed conservatively and with good result.
What is a slippery slope? Because you get into, I mean, we're looking at this, you chase an x-ray that tells us something that may or may not have been there before the symptoms came out, and it's looking at a static position of the hip. We're not seeing how the athlete's dynamically moving, and a lot of those things can clear up with not a simple movement assessment, but getting them moving better. Long story short.
Right. Well, that's it. I mean, amen to that, man. I think a lot of it comes down to actually looking how they move, assessing what sport they play, and maybe having them go through some of those movements to see if it recreates discomfort. And if it recreates discomfort, what can you do to potentially manage that so that you are aware of maybe some of the things that trigger it, so that maybe you can kind of modify from a training standpoint, how to modify around it so they can still train, right? The whole goal is to still train, right? And I think a lot of times PTs that are more of the traditional sense, they're like, maybe you should stop doing that and just wait till things calm down. But ultimately, you're deconditioning that tissue, right? And if you can't continue to strength train and do some of these different things that are modified around the person's issue, then you're maybe setting them up for a longer recovery than they should be having, right? So I definitely think, again, context matters and every situation is different, but ultimately our goal when people come to see us is we still want to train, but we're not trying to tell people, hey, stop doing things unless they absolutely need to do that, right? And if that's the case, then we kind of talk about that game plan. But ultimately, it and then figure out from there what can we do to make sure that the trigger isn't occurring, so that we can gradually get them back into a movement that they feel comfortable doing.
Yeah, and there's different variations to get at. Say, if squatting hurts, there's different variations even too to keep them squatting in some way without aggravating the hip and maintaining
box squat, elevated surf. Is it right? Exactly.
Yeah,
you got it.
Yeah, so and that's super interesting too, with just the modifications people can make to keep up strength. Don't assume that because squatting hurts that we should take it out altogether.
You got it. Right. But unfortunately, that's what they hear, right? They hear from, let's say they go to a primary care or they go to a healthcare provider that maybe isn't well versed in some of this stuff. And then the first thing they say is, well, if squatting hurts, don't do it. Right. Or if running hurts, don't do that either. Like, that's just, unfortunately, that's unrealistic, right? If someone is a barbell sport athlete or if someone is an avid runner and you tell them not to do the sport that they love doing, that's going to have a whole negative connotation just from the whole recovery standpoint, right? So now you got to kind of figure out how to navigate that as well as whatever injury they're dealing with. So, I definitely think as healthcare providers, we need to be more careful with how we talk to our clients and how we talk to our athletes to make sure that, hey, listen, we're on your side, right? We want to make sure that you get better, you get back to a level that you feel comfortable with. But at the same point in time, we want to be smart and make sure that longevity is the important part there, and it's at the center of what we want to do moving forward.
Yeah, and the big problem with that too is people squatting hurts, stop squatting, and they're a barbell athlete. So the hip gets better for a little bit because they haven't been squatting, but they still haven't learned how to squat. So they go back, they add it back in, and it's right to where it started.
It can get ugly pretty quickly there, right? So it's a matter of, one, educating them on, hey, listen, if so-and-so told you not to squat, well, let's maybe kind of see why you can't squat. Or if you're having issues, what can you do to further assess that, maybe modify around it.
Mm-hmm. I guess going along with that too, we had another question on biceps tendinitis with overhead athletes. Is that something you see?
Yeah. So I mean, I think biceps tendinitis, and we covered this, I think a couple months back on our Instagram. Is I think a bicep issue is a bicep a posterior rotator cuff or a posterior shoulder issue more than anything else. When you look at the proximity of where the bicep comes from. Right, it comes from obviously the shoulder itself, but the rotator cuff is very, very close in terms of proximity to where it attaches as well. So I definitely think when we talk about overhead athletes, whether it's a volleyball player, whether it's a baseball player, things like that, if the rotator cuff, and again, the rotator cuff's main job for those maybe who don't know is to kind of stabilize the ball in that socket at all times. If that rotator cuff isn't doing that very, very well, then maybe it puts excess stress on some of the surrounding tissues, in particular the bicep, right? So We see a lot of clinicians treat the bicep, and that's fine and dandy. But if you're not treating the source of the issue, which could be a lack of strength or a lack of stability at these extreme limits of the rotator cuff, and working on stabilizing there and working on capacity and rotator cuff in that fashion, then the bicep pain has a tendency to still be there. Now, if it's a chronic bicep issue, yes, you still need to load the bicep at some point in time, but you need to clear up the main source, which potentially I think is more rotator cuff, posterior shoulder than anything else.
Yeah, I think that's huge. And kind of, I mean, right along with the hip conversation of you can't just solely look at the tissue that's involved isn't always the one that's the problem tissue. It's sometimes just the one that's the most overworked and ticked off because surrounding areas aren't helping out.
Yeah, I mean, again, if you look at just being so tunnel vision towards that tissue, then you miss the big picture, right? Again, you also got to look at the neck too. You can't rule out the neck either. You got to rule in the neck, rule out the neck from there, and then work your way down into the shoulder. Is it a thoracic spine issue? Right? Can they not maybe extend the thoracic spine, which then puts more stress on the front side of the shoulder? Right? So these are all these things that we need to make sure that we're doing, so that one, it's comprehensive, so that the athlete understands we're looking out for them. And then two, we're not just trying to put out a fire, right? We're not just trying to put out the bicep pain and then all of a sudden get back to whatever they want to do. And then all of a sudden it comes back a couple months later. We want to address it right now so that long term it doesn't come on, maybe later down the road.
Yeah, long-term solutions are what we should all be after. Anyone can make it feel good.
Always striving for that.
There's a lot of things that can make it feel good in the short term, but that won't get you back to what you're doing.
Absolutely. Cool. Like we talked about, you gotta load tissue. Like you have to load tissue for it to adapt. And if you're not doing that, if you're not doing it adequately or suboptimally, then obviously these things will have a tendency to linger.
And loading the right tissues too. Like you said, if people think
the
biceps is involved, so I have to eccentrically, do all these things I read about, but it could be that there's other tissues around it that need to get loaded and build up endurance and strength and all that.
You got it.
Yeah,
no question.
Cool. I think the only other question we had, we kind of touched on this a little bit, but someone asking how you got from the traditional model of PT, insurance-based model, and for those that aren't too familiar with insurance-based model, it varies from practice, but a lot of times multiple patients an hour, 2 as much as 4 typically, versus you tend to be more in the full hour to, you said 70 minutes with some people, and kind of how that transition, how that transition happened.
Yeah, I mean, honestly, when I think back at it, I probably should transition a lot faster. But here I am. I've been practicing 10 years for the first 8.5. So my first year out of PT school, I did travel PT, and then for the 7+ years after that, I was in the traditional outpatient model, right? Multiple clients per hour. Again, unfortunately, when you're looking at the insurance-based model, insurance don't really care about you or myself or any of the clients that they have coverage with. Right, and they're more concerned about how can we get these people to pay premiums, right, and then pay the least amount of money to the providers that are providing the care, right? So that's just my opinion. But listen, I've seen it long enough. I've been in practice long enough to understand that insurance companies aren't for your best interest; they're the best interest of themselves. So I think the best way the way I transitioned was, honestly, I got to the point where I just felt like I wasn't providing the care that I thought I'd be providing when I got out of PT school. And it took me a long time to figure that out. I just thought this was the norm. The norm was, hey, listen, you see 2 to 4, 3 to 5 patients per hour, and this is what it's like across the board. And that's why I think Jared Carter's podcast was such an eye-opener for me, because there were people that were doing cash models. And again, there have been people doing that in a cash sense for a long time, but I wasn't really exposed to that until Jared's podcast maybe 4 years ago, where I started listening to it. I'm like, man, these people are doing something significantly different. It sounds exactly what I wanted to do. And I tried to figure out, well, if we were to take a chance, I mean, again, when I first listened to those podcasts, I talked to my wife, and I was like, you're crazy. There's no way that's going to happen, right? And here we are doing it. So I definitely think transitioning, it's not easy. I'll just be honest, right? Leaving a steady paycheck, leaving health insurance on the table to pursue a passion can be anxiety ridden. I mean, I'll be a perfect example of that. I mean, each and every week we try and figure out how to be more consistent so that we're not worried about when the next payments coming in or whatever it may be. But at the same point in time, it's so much more fulfilling and it's so much more gratifying understanding what we want to do and putting a vision out there that we want to try and provide. Right? Our care, we feel, is so unique to the area. When we opened up in Rochester, a year and a half ago, I think we were the only solely cash-based practice in Rochester. Now, I see a couple here and there that are popping up, which is awesome, which is great, right? I think the more we can educate people on what we do and how we do it, and maybe why it's different than some of the big box clinics or some of the hospital systems that are so volume driven. Like, we get those people to come see us. Like, hey, listen, I went to the hospital. They were seeing, 4 or 5 people in an hour, and I felt like I wasn't getting the attention that I deserved. And they're still paying whatever they're paying out of pocket. And I think it's one of those things where, if people want to get better and they know that they want to get better faster, then we can be a good option for them, right? If they want to use their insurance and they want to go that route, by all means, there are plenty of places to do that, right? But if we can fit their need or fill a void that maybe they haven't been, accustomed to, going through, then I think that's why we tried to transition to more of this one-on-one model. And again, like I said, I was a strength coach first and then became a PT. Strength conditioning on a one-on-one setting or in a group setting. Like, I love doing that stuff. And that's kind of where I feel like I more resonate with that type of population with obviously with our sports PT background. But, I think transitioning, it can be hard. It doesn't necessarily mean you need to transition all the way. You can still have a little bit of what we call a side gig, right? You can still do some maybe one-on-one treatments to see how it goes while you're still in that, in network-based clinic. And then from there, if you feel like you're getting some good traction with doing that, then make that transition and go full on. And I think that's the best way to do it.
And there's plenty of ways to gain traction without, fully jumping in head first. For some people, that's what they have to do. But there's a lot of ways to toe the water with, like, we get back to social media and ways to start getting content out and start networking. And there's plenty of ways to see if that'll happen. Because I know a lot of people that think it's just a matter of, well, once I design my logo and open doors up, people are going to flood in, and me and you both know.
Man, that ain't the case. I mean, that couldn't be further from the truth, man. People still need to know who you are and what you do, and the more you can get some exposure, either through social media and in the community and things like that, you start there, and then hopefully that kind of builds, and then all of a sudden people start talking about you in a positive light, and all of a sudden people start calling on your phone there, which is always what you want.
For sure. Yeah, someone kind of pursuing what you love, worth more than a paycheck, and there's nothing wrong with the insurance models for some of the people. If you're there's definitely ones out there that are doing it better than the others, and if you're
absolutely,
it's not there's not a need to make that jump if you don't have the passion for it. But if there's something pulling at you that is something you want to be doing, then it's sooner or later it's something you gotta put out there.
And I think too, a lot of times, I think that the traditional PT will listen to this like, oh, well, you're bashing other PTs. Like, listen, it's to no fault of the clinician, right? It's to the fault of the system that they're in, right? I think that's just how it is, right? And the fact that we have to be accepting of that, that's not what we want, right? We're always striving for better. We always strive to, one, take care of our people that are coming into our doors, but ultimately, two, we need to take care of ourselves as well. We need to be able to kind of put food on the table. We need to pay bills. We need to be financially sound. And, to just say, hey, listen, well, this is what I'm going to pay you. This is what you should take. I mean, I think that's very, very short-sighted. So again, that's just my opinion. But, I think there are a lot of great clinicians in the traditional sense that are doing awesome things, but they're handcuffed to an extent because of what the model is presenting to them at this point in time. And with insurances continuing to pay less and less and less for, let's say, a PT service, then you can only do so much before all of a sudden your volume has to kind of meet somewhere in order to kind of keep the doors open. And that becomes the struggle at times.
Absolutely.
Yeah.
Cool. Dude, such a great time talking
awesome.
with you, man. Well, before we close up and hear where to find you at, I do want to hear, we talk about the benefits of social media, but there's also, and I'm not trying to put you on the spot too much, but I want to hear one thing that, people don't get to see about you that only follow you on social media. So I think social media is great, but, I like knowing, more on a personal level, what's something that people may not know about you that are just reading your stories and reading your posts.
Yeah. I mean, I'll say this. I am an avid fantasy football player. Baseball as well. I've been doing it forever. And then to be able to turn that, and again, and when you look at that, and to be able to turn that into a proposition where I'm now being paid to have my conversation and to have my thoughts on fantasy football or fantasy baseball, I mean, I think it just goes to show you that there are a lot of opportunities out there for clinicians that are outside of just the clinical work. It's just a matter of figuring out how best to pursue that, and again, filling a void where maybe a void is needed, right? Or filling a need where it's needed, right? So, I am an avid fantasy football player. I mean, I do it each and every year. There is a lot of flack that goes on and trash talking with a lot of my folks, friends back home, and then obviously for the business that I do. So, if people are looking for fantasy football related content and stuff like that, check out 4for4, 4for4.com. That's our fantasy football website that I do my content for. But also check Sports Illustrated. Sports Illustrated has been a massive outlet for us in terms of our content, and all the stuff from 4for4 goes on Sports Illustrated. So again, never would I have ever thought that me doing fantasy sports has led me down to now providing content for Sports Illustrated. It's so just awesome. Crazy, man. Yeah. But again, I think it's the power of, obviously, turning something that you love and that you're passionate about into obviously something that can potentially give you a monetary gain too.
Well, the natural follow-up question to that is, how did the season go? You can't just bring it up and not talk about.
So let's see. So in let's see, in 3 or 4 of our leagues that I'm in, out of the, I'm not going to say how many leagues that I'm in total. I did not win the championship this year, but I came in semis, and then I finished in 3rd in a couple of leagues as well. So a couple of injuries kind of bit me at the end there, but hey, listen, that's fantasy football. That's how things go,
That's nice.
But I will show you this. Hold on, I will show you this.
Yeah.
We go crazy with fantasy football. Like this is one of my trophies, right? So we don't mess around when we play fantasy football. Yes. So we try and we have a good time with it. So again, it's all fun and games, and it's be able to try and figure out how best to again leverage your idea of what injury and recovery is, and try and leverage that in fantasy sports. I think that's a great way to kind of tie a lot of those two things together.
Yeah. And you're Johnny just chimed in. You're his not so secret man crush. So
Johnny T, man, what's going on, man? Good to see you.
Yeah. So Russ, I want you, dude. I appreciate the time, man. It's been a blast.
Why don't you just finish up,
tell people where where best places to find you at? You can list probably 40 places that you're at. So
I would say probably the best place to get us is on Instagram. It's just at Mana, MANA Performance Therapy. If you want to email me, you're more than welcome to email me about anything, whether it's business, whether it's PT, whether it's strength conditioning, whatever it may be. It's just Russ, RUSS, at Mana Performance Therapy. And then, I think that's the best way to get a hold of me is between those 2 outlets there. We've got a number of different things going on. But if you want to learn more about, some of the stuff that we're doing, maybe some about the mentorship program that we've got going on, and those are all avenues that I would love to have a conversation about with whoever's watching this or whoever wants to kind of have a little bit more of a talk.
Absolutely. Well, I appreciate it. Russ you've been a huge influence on me, and I'm just, stoked to have gotten you on.
Well, likewise, man. Likewise.
Talk more shop.
Hey, listen, I'm honored. I'm honored to be the first guest on your IG live series, man. I'm honored, man. So I appreciate you reaching out.
That's prime time. People are gonna look back on this one day and be like, man, who's the first guest on there? We got to see it.
That's right.
It'll be a screenshot of you holding up that trophy too.
That's right. Well, perfect, man. I appreciate having me on.
All right, Russ. Hey, we'll talk to you soon, guys. If you have any questions, reach out to Russ. You know where to find me on IG, but we'll talk to you guys soon.
See you guys. Thanks again.
All right, later.